Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, the Director of Speaking of Women's Health. And it's so wonderful to join you today on Memorial Day 2023. And this is a really special weekend for me personally because my third grandchild was born. Beatrice Clara Thacker, 8 pounds, 3 ounces. Oh, she's just a beautiful, beautiful, perfect little newborn. And you can see some pictures of her on Speaking of Women's Health Facebook and Twitter and Instagram. So if you're not following us on those channels, please follow us. And hopefully you're following us on Rumble because we're doing some vlogging of these podcasts. And in order to get notified or know what our recent posts are, I would definitely recommend that you subscribe anywhere you subscribe to podcast for free to Speaking of Women's Health. So when I was at the hospital the other day to see baby Beatrice, her other grandmother was there who apparently listens to some of these podcasts. And she said, I really enjoyed the one on cheese, but can you do one for chicks with high cholesterol? So, Ildi, this one's for you. Certainly, cardiovascular disease is the leading cause of death. So when you look at a brand new newborn girl or boy who lives in the United States, certainly cardiovascular disease still remains the number one cause of death. Now that can be from hardening of the arteries, of which cholesterol and inflammation play a role, as well as hypertensive heart disease. And hypertension is pretty ubiquitous. Most people over age 50 to 55 have high blood pressure, and not a day goes by in my practice where I see someone who has an elevated blood pressure. Actually, 120 over 80 is the old normal. That is now pre-hypertension. So you really want to know what your blood pressure is. You want it tested when you're relaxed in the seated position, your legs uncrossed, your arm out to the level of your heart, not right after exercise or within 30 minutes of caffeine. And so many of my patients say, oh, but doctor, my blood pressure's always been normal. And then I say, well, yes, I remember when my blood pressure was 80 over 60, which in some people could cause them to pass out. But I was young and healthy, and it was very, very low, just like my heart rate. And with age, it just creeps up. And we just have this artificial cut point. Once it's 130 over 80 for 3 or more readings, that gets you the diagnosis of primary hypertension. So some of the risk factors for cardiovascular disease include hypertension, and women after age 65 do have a higher rate of stroke. So that is so important. Certainly any kind of nicotine use, tobacco use definitely increases cardiovascular disease. And high cholesterol is interesting. In and of itself, there are people who have very high cholesterol levels who don't have any known cardiovascular disease. And it's trickier in women because the use of cholesterol-lowering agents in women, the most common kind are statins, although we have bile acid sequestrants, we have slow-release niacin that can slightly raise HDL, and we have some other exciting, more expensive, newer medications when the statins fail. Certainly, if you're a woman who has known cardiovascular disease or a heart disease equivalent, such as type 2 diabetes, then certainly you want to consider a statin to lower that LDL cholesterol below 100 or even below 70 for regression. But if you're just the typical 40s, 50s, even a healthy 60-something-year-old with elevated cholesterol and no known heart disease, in women, when you prescribe statins, you actually increase the risk of diabetes. And there's no primary prevention with statins in women where there is for men. Now, in both men and women who have known heart disease, there is secondary prevention of cardiovascular disease with statins. Statins are best dosed in the evening when your body makes cholesterol, And in Europe, they don't even give women statins unless they're also giving them the over-the-counter antioxidant supplement coenzyme Q10. Now, there's certain foods that have coenzyme Q10, like raspberries and blueberries and blackberries and certain superfoods. But if you're a woman, especially if you have any muscle aches or pains, you probably do want to get a good quality coenzyme Q10. Not necessarily the cheapest brand, but you might want to check on consumerlab.com or check with your physician for a brand that is known to have CoQ10 in it. And certainly if you're on a long-term cardiovascular preventive medicine, particularly with blood pressure medicines, you generally always continue that unless specifically instructed not to. But with statins, there can be drug-drug interactions with antibiotics, and I find a lot of women not only aren't told to take their statin at night, but they're not told to stop it temporarily if they're on antibiotics so they don't have any increased risk of rhabdomyolysis. And furthermore, if you're a woman on statins, you really do need that hemoglobin A1C blood test checked. That tells you what your blood sugar is over the last 3 months based on the life of the red blood cell. Now, certainly we always recommend the heart-healthy Mediterranean diet. And some of the previous recommendations, the food pyramid, really has been turned upside down on its head. We do want heart-healthy fats like olive oil and avocado and fatty fishes that are rich in omega-3s, lean cuts of meat in moderation, certainly avoiding trans fats, a lot of seed oils, a lot of highly processed foods. We want fruits and vegetables, whole foods, where as much as you can. And some people are salt or sodium sensitive and have to watch that. But all that being said, there are low-fat cheeses that are good for your bones, not bad on your waistline or your cholesterol level. And I see some women obsessively avoiding fat content and getting a lot more simple carbohydrates, which really drive insulin. And so in addition to talking about cholesterol today, we're going to talk about calcium, since dairy products really are so important for source of calcium, which is important for so many different enzymatic processes in the body as well as bone health. And we're going to talk about insulin resistance and sugar, because if you have a lot of simple carbohydrates in your diet, it will drive triglycerides, and triglycerides can increase the risk of heart disease in women. Now, when I see a woman who doesn't have any known cardiovascular disease and she is not sure what her risk is, you can do calculations from the Framingham Heart calculator to calculate a woman's risk for cardiovascular disease in the next decade, placing them at low risk, intermediate risk, or high risk. And certainly high risk women need to be treated intensively, and low risk women just need to focus on diet and exercise and follow-up. And then it depends on if you're in the intermediate category. Certainly in women who are over age 60 and have known cardiovascular disease, based on data from Tommy Makola and colleagues in Finland, if you're over 60 with vascular disease, it's better to be on both hormone therapy if you've been on it and a statin than just a statin or just estrogen or hormone therapy in terms of reducing the risk of heart attack and stroke. Now, if you're in your 50s and you don't have any cardiovascular disease, then hormone therapy actually reduces death rates and cardiovascular disease by 30%. And I think it's just really terrible that some of these preventive aspects have not been emphasized in the last 20 years. And I've certainly podcasted my book, The Cleveland Clinic Guide to Menopause, and I updated it. And I podcasted about the 20th anniversary of the Women's Health Initiative. And the official recommendations still are not just to use it for prevention, but a lot of women have some annoying menopausal symptoms that they can power through. But if they knew that hormone therapy reduced diabetes, which is a significant risk factor for heart disease in women, even more so than it is in men, and that statins don't give primary prevention and do increase diabetes risk in women in their 50s, I think it would change a lot of people's perceptions. So one of the reasons why we like low-fat dairy products is because it's rich in calcium, which is great for the bones. Now, there's lots of other ways to get calcium too, but you have to work harder if you avoid all dairy products. And we don't have any evidence that ingesting dairy products increases atherosclerotic disease. And if you're a woman who's not taking any birth control pills or oral hormones, who has borderline elevated cholesterol levels, if you're healthy and in your normal state of health, you might want to ask your physician to get an ultrasensitive CRP level, because when I have women that have elevated lipid levels but no evidence of cardiovascular disease, no family history of premature heart disease, no hypertension or diabetes or cigarette smoking or autoimmune conditions which increase inflammation and the risk of cardiovascular disease, many times I'll order this ultrasensitive CRP test because that seems to correlate to risk of cardiovascular outcomes in women better than actually the LDL cholesterol. And when you get your cholesterol panel, which is generally in the fasting state, not only do you get your total cholesterol, but you get the HDL good cholesterol, the LDL bad cholesterol, and the triglyceride levels. And as I mentioned, triglycerides are driven by simple carbohydrates and sugar. So getting back to calcium, as we celebrate and remember the fallen on this Memorial Day, we pause to focus on what's made America great. And we cherish our liberty and our freedom, and we deeply respect those who have served our country and were willing to lay down their life to protect our great nation. And I think every Memorial Day, when I see red poppies, not only will I be grateful for those who gave the ultimate sacrifice, but I'm also going to think of Beatrice and how this was her birthday weekend and how new life is so exciting. And it's very important to start out with very healthy habits. And of course, milk is what babies get as their primary source of nutrition, which is really, really rich in calcium. Now, as you get older, people say, well, I'm not a child, I don't really need to drink milk, or I'm lactose intolerant, or I've just heard cheese is not good for your heart, and other myths. So this Memorial Day, I'm going to just simply ask, and I did a column on this, is calcium a patriot or not? And calcium ranks almost as high as baseball and apple pie and mom in terms of American favorability ratings. So what's the real story? Calcium is one of the most abundant and important minerals in the human body. And it's not only critical for bone and dental health, but it plays a role in many other parts of the body. And we're going to actually have some upcoming podcasts with some dentists and pediatric dentists, because Beatrice's older sister had some dental trauma. And as a osteoporosis physician, I have certainly done research in the links to dental and periodontal health and osteoporosis and whether women are treated or not. And that research basically revealed that if you have osteoporosis and it's being treated, you have better dental health and better gum health. And even though I know that from an osteoporosis standpoint, I really am certainly not an expert on pediatric dental health and pediatric trauma. So I thought, oh, that would be a great idea for a podcast. So stay tuned for those to come up in the future. So besides bone and teeth, calcium regulates muscle contraction. It affects blood vessel function, transmission of nerve impulses, and regulation of many enzymes throughout the body. So how does calcium work in the body? Well, it's mainly stored in the skeleton. I describe your bones as your bank of calcium. And if you've got a good bank, you can take out more before you put some in before going bankrupt or breaking your bones. And our bones are active living tissue that regenerate, just like our skin does and our liver. And it takes about 7 years to totally remodel your skeleton. Now, in a child, the bones are rapidly growing and they're much softer. So bone breakage in a child is not ominous as it is in adults, where it can portend bad bone health. So if you don't have enough calcium in your bloodstream, then you can have cardiac arrhythmias and all sorts of problems. So over time, folks that have really poor dietary calcium intakes or poor gut absorption, or people who have leaky kidneys, and about 40% of women with osteoporosis take in enough calcium, absorb enough, but they leak too much out. And they, over many years, can get negative calcium balance. So it's kind of like overdrawing on your checking account, not a good thing. And I'll frequently prescribe very low-dose thiazide diuretics like hydrochlorothiazide or Maxide or chlorthalidone, also known as Hygrotin. And I'll have women say, well, I don't have high blood pressure. I don't need to take this. And we don't use blood pressure doses. We use very baby doses to stop that calcium leak, which actually reduces kidney stones as well as osteoporosis. And this can affect men. My middle son, who's the father of Lincoln, he had a kidney stone at age 18. And he thought, oh, I'm dehydrated. I'm at football practice in college. And after he recovered, we did the urine test, and sure enough, every single time he had very high levels. And had that not been treated over time, he could have just wasted his skeleton away. And so if you do have problems with calcium, osteoporosis, even though it's a little bit of a hassle to collect your urine for 24 hours, your bones and your kidneys will thank you. And if you have too much blood calcium in your bloodstream, that can also be a dangerous problem, just like not enough. But you can't just draw a blood test and see what your calcium level is. You can with other minerals and substances like potassium or blood sugar, but not with calcium, because your body will always steal it out of your bones.
We'll be back after a quick break.
Hey, quick question for you. Are you someone who wants to be fit, healthy, and happy? And what if I told you could get your dream body by simply just listening to a podcast? I'm Josh.
And I'm KG, and we're the hosts of the Fit, Healthy, and Happy podcast.
Listen, we get it. Fitness isn't easy. Carbs, no carbs.
Just stop, okay? It doesn't have to be that complicated. And that's why we made this podcast. We get straight to the facts so you can become your best you.
So the way to check us out is click the link in the show notes or search Fit, Healthy, and Happy podcast on any of the major podcast platforms. We'll see you soon.
And because a lot of people are lactose intolerant, meaning they're intolerant to the milk sugar lactose, and they lack the enzyme lactase to break down the milk sugar, and that sugar can cause gas and bloating. Many times people turn to calcium supplements if they avoid dairy. Now, you can still get enough calcium in your diet, and I strongly recommend you go to speakingofwomenshealth.com and look up our calcium calculator. Pregnant women, breastfeeding women, or postmenopausal women not on estrogen tend to need more calcium than those who are vitamin D replete and hormonally replete and have a balanced diet. Both being low in estrogen, which uniformly happens to women after menopause, and low vitamin D impedes the intestinal gut absorption of calcium. If you're someone who's maybe had a history of calcium oxalate kidney stones, that's another situation where I would usually want to check the urinary levels. And if you need a calcium supplement, we usually just recommend the calcium citrate salt, because we don't want extra oxalates. And there's a lot of foods that have citrates, like citrus foods. In fact, my son that has the kidney stones likes to chew on the rind of oranges and limes and lemons. I think that's kind of his way of trying to get some extra citrate. Now, this podcast, of course, is not medical advice. You need to see your own healthcare team. But ingesting too much salt and sodium, which is common in the American diet, especially over holidays like Memorial Day, actually does further promote calcium loss in the urine. So every day, pretty much a woman asks me, well, doctor, should I take calcium supplements? And I always reply that it's best to get calcium in your diet, just like it's best to get nutrients from your diet, not in just a pill form or supplement. Now, vitamin K2, also known as M7, plays a very important role in bone and cardiovascular health. And dark chicken meat and pork and bacon and a few cheeses, we're getting back to those cheeses, Swiss, Gouda, and Blue, have K2 in them. So If you're one of the best sources of K2 or M7 is Japanese natto. That is loaded. So depending on, ethnic and types of food you eat, you might not need K2. But a lot of my patients, even with a varied diet, particularly in northern climates, need D3. And one of our most popular podcasts is on all the different health and immune benefits of D3. So if you haven't caught that podcast, it's really worth listening to again. But a lot of people need K2. Now, eggs have choline, which is good for muscle cramps. And a lot of people don't want to eat eggs because they say, oh, it's so high in cholesterol. But eggs are an excellent source of foods. And just like shrimp and certain seafoods have cholesterol, but if they're not loaded with a lot of animal fat and lard, they are very healthy foods. And also some of the seafoods, of course, have omega-3, which our body can't make. And that's very important for cardiovascular health. I'll probably do a future podcast on omega-3s and fish oil. And basically the bottom line is it's better to eat it than it is to take it in supplement form. And really, if you don't have severely dry eyes that your ophthalmologist has recommended omega-3 or very high triglycerides that you've been recommended to take high dose fish oil, in some cases of rheumatoid arthritis or other autoimmune conditions, generally speaking, most of us don't need to be taking a fish oil capsule. So as you wrap up this Memorial Day and other future holidays that you gather with friends and family and you remember our American heroes, and you may remember those that have gone on to the next life, you certainly can celebrate with calcium-rich foods, with or without the K2 foods or via supplement if needed to strengthen your bones. So one of the things that I served for our family was red, white, and blue. I took some strawberries and blueberries and I topped it off with a little bit of vanilla yogurt. Salmon on the grill is excellent and rich in calcium. And adding dark green leafy greens to your salad, or if you're frying up, grilling rather, some hamburgers. And it is okay to have a small scoop of ice cream along with that slice of mom's apple pie. And there was some delicious apple pie that Beatrice's other grandmother brought. She, of course, couldn't have any, just being only 1 day of age, but I'm sure her big sister Artemis had it. So one of the risk factors for cardiovascular disease in women, even though women tend to show that disease later in life than men, is actually the age of menopause. And researchers have studied that relationship between the menopause transition and cardiovascular risk for 20 years. And menopausal therapy can certainly affect cardiovascular risk. And if you start with healthy arteries, there's a lot of beneficial effects that estrogen has on lipid levels and ratios, although oral estrogen can raise triglycerides. So women with high triglycerides and diabetes actually may want the patch over oral. But some oral estrogens, like conjugated equine estrogens, actually have been shown to reduce epicardial fat. Estrogens help with nitric oxide, which helps the blood vessel tone, helps and acts like a calcium channel blocker, which we do have calcium channel blocking medicines that are used for hypertension and migraines. But following women over a period of a couple of decades, researchers have studied chronologic age along with ovarian aging and this connection to cardiovascular risk. And they found very distinct patterns of sex hormone changes, along with weight gain, body composition, lipids, and lipoproteins, and measures of vascular health during menopause can increase a woman's risk of developing postmenopausal cardiovascular disease. So it's very important at midlife to really focus on your cardiovascular risk assessment. You might want to make a separate appointment just to get that risk assessment. So for many years, I've been lecturing, writing, teaching, and sharing with my colleagues and my patients the fact that estrogen is very important in prevention of cardiovascular disease and blood vessel diseases. And a small group of menopause leaders, including myself, have sadly known that our message about estrogen and the prevention of cardiovascular disease would not be accepted until a major health organization recognized the importance of menopause and cardiovascular disease. Because it seems like in the United States, that kind of guidance from a big organization seems to be the single most important factor in achieving behavioral change among practicing physicians. The menopause communities have been recommending all along to consider the health benefits of hormone therapy, including diabetes risk reduction in women who are under age 65 and within a decade of menopause, or particularly in those women who have early or premature menopause. Back in 2011, the American Heart Association guidelines for heart disease in women didn't even include information about menopause as being a risk factor. But more recent iterations have, as well as looking at other female factors, such as diabetes being a bigger risk for women, such as having gestational diabetes or preeclampsia leading to more cardiovascular disease. In fact, gestational diabetes increases sleep apnea risk, and sleep apnea is a problem in terms of exacerbating blood pressure and weight gain and cardiovascular disease. And women that have pregnancy-induced hypertension have a higher rate of subsequent diagnosis of primary hypertension. So, what's the treatment for preventing heart disease during menopause? Well, certainly all the standard lifestyle interventions are very, very important. But it is important to understand that several randomized controlled trials consistently support the use of menopausal hormone therapy to prevent all-cause mortality and coronary events, which simply does not exist for either aspirin or the cholesterol-lowering statins for primary prevention. And the data for secondary prevention with statins is there with women, but it's not as strong as you might think. And certainly high-dose statins in elderly women has been associated with a twofold increase in hemorrhagic stroke. So it's very important to really get detailed cardiovascular risk assessment. Stress tests can show physical fitness levels and give us an estimation of your 10-year risk for cardiovascular mortality. Also, coronary calcium scores, which do involve, some radiation, can look and give you a rating of the burden of cardiovascular disease you have. Some will do intimal carotid artery ultrasound looking for any signs of vascular disease. I think it's very important to know your family's biological history. And I'll frequently ask women, what kills people in your biological family? And it kind of takes them aback. And we all are going to die. And just like we celebrate brand new life, which is so exciting, there is a normal life cycle. And sometimes during family gatherings, whether it's Thanksgiving or Memorial Day or whatever special time that you gather to remember loved ones who have passed as well as look forward to the future, getting your family history of biological relatives is very important. So in terms of lifestyle interventions, you want to achieve ideal cardiovascular health. And certainly smoking cessation is non-negotiable. It's really an absolute. And there's a lot of resources to help people with a nicotine addiction. And we have a lot of good resources on speakingofwomenshealth.com. Weight loss, which is very difficult, and it is the biggest concern in midlife women. We have a lot of information on different diets, on intermittent fasting, and some of these exciting new medicines that we have. The DASH program, which is Dietary Approaches to Stop Hypertension, is important. And certainly being physical activity, move more, sit less. Optimization of cholesterol ratios, fasting blood sugar, and knowing what your blood pressure is. In fact, I pretty much tell all my patients over 50 they need a blood pressure cuff. Just like you need your first aid kit, I think it is helpful to have aspirin on hand if there's no aspirin allergies, not to take it necessarily in a healthy person to prevent heart disease, but if someone is experiencing what is thought to be angina or some ischemic event. And if you're instructed to take an aspirin, I think that's helpful to have on hand. But really, we want to do all these things before getting into any kind of urgent situation. And so we know that controlling these factors is a big deal, but we can't change our genetics. And so that's why it's good that we have interventions if we need to treat diabetes, treat high blood pressure, treat elevated lipid levels. And in women, one of the lipoproteins that's important is Lp(a). The higher that is, the higher the risk of cardiovascular disease. And estrogen is one of the only couple things that will actually reduce Lp(a). Niacin is another one, but that can cause some flushing and affect the liver, and so it's a little bit hard to take. So have you heard the body fruit weight comparisons? Are you pear-shaped or apple-shaped? Many women put on weight in the thighs and buttocks and gives that curvy female look. Others maintain thinner legs, but really put it on in the belly. And that's really the worst kind of weight to have, because the apple-shaped body is associated with higher rates of elevated insulin levels, which can lead to further weight gain and in turn promotes inflammation, diabetes, heart disease. And really, inflammation is an integral part of the problem with these other risk factors. So that's why many go to plant-based diets, treating whatever inflammatory conditions they have, working to get that abdominal adiposity down, all reduces inflammation. So the risk factors for diabetes and insulin resistance include having gestational diabetes, having had a baby over 9 pounds, having preeclampsia, eclampsia, or toxemia of pregnancy. Also, polycystic ovary condition, PCOS. Genetic factors such as a strong family history of type 2 diabetes. Certain ethnic backgrounds based on genetics can imply a higher rate of certain diabetes risk in certain populations, and that's why it's important to know your family history. Advancing age, if you're over 45, that's not modifiable. We can't change your age, and you should be screened at least every 3 years with a fasting blood sugar. Fat distribution in the abdomen, you should know your waist to hip circumference ratio, and your waist should be smaller than your hips. So how can you decrease the risk for diabetes? Well, lowering the blood sugar by reducing abdominal weight and sensitizing your body to insulin. If you're insensitive to the effects of insulin, more insulin is made, which in turn causes problems like disruption of ovulation if you're a premenopausal woman. Excess insulin secretion is hard on your pancreas, and this occurs due to insulin resistance of the excess body fat in one's body. So it's very important to reduce insulin resistance. So some of the top 10 insulin sensitizers, this is taken from one of my columns about how to be less sweet. In fact, whenever we're out to eat and someone asks my husband if he wants any sugar for his iced tea, he always says he is sweet enough. And I think that's a good attitude to adopt, that we really are sweet enough. Now, certainly young children who are picky eaters and rapidly growing, and their metabolism is so much higher than ours, and the brain gets its energy primarily off of sugar and simple carbohydrates. Certainly you don't want to eliminate all simple sugars, especially in young growing people. But if you're already fully formed and you're at risk for cardiovascular disease, which most Americans are, I think it's really good to try to eliminate most simple sugars like white bread, white rice, simple sugars and sweets, and focus on those heart-healthy fats, which can include low-fat cheeses, olive oil, nuts, avocados, seeds, and some of the foods that are really rich in omega-3 fatty acids, EPA and DHA, like fish, flax, walnuts, chia seeds, and almonds. Oh, I had a great red mango cherry kind of patriotic with chia seeds smoothie. That was really good. You want complete proteins, complex carbohydrates that include legumes, beans, lentils, more complex carbohydrates. Many folks will count carbs instead of counting calories and find it a little bit easier.
We'll be back after a quick break.
Have you ever experienced fitness failure? You know, you set a goal to exercise, you're all excited, and then you're not. Hi, I'm Dave. I host the daily 10-minute podcast, Walking is Fitness. Instead of an exercise goal, I talk about making a fitness promise. And every day you keep that promise, you add another link to a growing fitness chain. This is a podcast of action. You'll create a fitness habit, which eventually becomes fitness momentum, and then on to all kinds of good stuff. Check it out. Walking is Fitness, and let's take a daily 10-minute walk together.
To lose weight by counting that instead of calories, focusing more on lean protein and heart healthy fats. The traditional low fat diet works for some people, but not as many. And a lot of people drive their insulin levels by having a lot of simple carbs, which can cause weight gain and higher triglycerides. So exercise, that's number 2. I mean, that is just so important in terms of helping your body get more sensitive to insulin. And it does this by helping your muscles just take up the sugar on its own, reducing the amount of insulin your overworked poor pancreas needs to make. It also strengthens and builds muscle and improves your basal metabolic rate and reduces diabetes risk and or helps control sugar in folks with type 2 diabetes. Now, bariatric surgery is number 3. And it can be a cure for type 2 diabetes in people with very high BMIs and multiple medical problems. And diabetes can go into remission even before there's any weight loss, due in part to effects on gut hormones. But this is very dramatic, and it's major surgery, and it still requires lifelong attention on diet and exercise. And I think is going to be supplanted in large part by this exciting new peptide group of medications that are injectable and may also be eventually available orally to do the same thing on the gut hormones. And even though it was a podcast for physicians and nurses and pharmacists for continuing medical education, I strongly recommend you go back and listen to my podcast on menopause and weight loss with obesity and women's health expert Dr. Tara Iyer and I. Number 4, medications. Medicines such as metformin or glucophage is an insulin sensitizer and can help lower blood sugar, lower body weight, and has been even used in women with polycystic ovaries to improve menstrual disorders and infertility associated with insulin resistance. And it's really the only typical oral diabetic medicine that does not cause weight gain, and it seems to have some anti-aging effects. It can certainly affect the gut and cause GI distress. Adequate renal function has to be in place in order to avoid acidosis. Number 5, berberine, and this is common use amongst the PCOS crowd and our functional medicine folks. Berberine is an ancient remedy from traditional Chinese medicine that it's derived from plants, and it has a very broad range of pharmacologic effects, from anti-cancer to anti-infective. However, berberine's ability to lower blood sugar and body fat are those most relevant to people that already have elevated blood sugars. And berberine's blood sugar lowering effects, in combination with all the lifestyle modifications, did show greater improvements in glucose levels, hemoglobin A1C, which you definitely want under 7%, hopefully under 6%, and plasma lipids than lifestyle changes alone. Berberine is an exciting natural compound that can be found over the counter, but individuals with diabetes should not rely on this alone, and really you should consult a physician before use, and it can have some gut side effects. Number 6, antioxidants. Antioxidants such as alpha-lipoic acid, ALA, is an antioxidant, and it's found in many foods. It's also made in our bodies. Studies have shown that there's better insulin sensitivity with ALA, and you can find it in spinach, which was also in my smoothie today, broccoli, tomatoes, Brussels sprouts, beets, and red meat as well. In fact, I know a nurse who had a strong family history of diabetes, and she was thin and she ate well and she exercised, but with age, her blood sugar was creeping up, and she added some ALA and came right down. Number 7, supplements such as D-chiroinositol, DCI, is a secondary messenger in insulin signal transduction, and it has been found in buckwheat farinata and has been used in women. Certainly, I know a lot of PCOS women will get this and use this in place of typical flour. And this has been shown in women with PCOS to improve blood sugar control and helps promote regular ovulation. And we have an endocrinologist in our Center for Specialized Women's Health, Dr. Ula Abed, who's done a lot of research on different diets in women with PCOS and improve fertility outcomes just with diet alone as opposed to medications. So I will have to get her booked for one of these future podcasts. Number 8, trace minerals. Chromium is an essential trace mineral that is a cofactor in various enzymatic reactions in the body, and it is involved in the regulation of blood sugar. Good food sources include black pepper, thyme, brewer's yeast, and lean meats. Number 9, spices. You always see cinnamon paired a lot of times with sugar, like in apple pie. And cinnamon does reduce insulin levels after mealtime. So 3 to 6 grams have been used in studies, but those 3 to 6 grams are a lot and typically not what's found in the food dishes. So just adding sugar to a little bit of your cinnamon is not going to be helping your blood sugar. Number 10, acetic acid, specifically apple cider vinegar. And I made a few dishes for this Memorial Day weekend using apple cider vinegar. It's high in acetic acid, and it's been shown to improve insulin sensitivity as it suppresses disaccharidase activity, similar to a medicine that's sometimes prescribed for people with diabetes called acarbose. So instead of a spoonful of sugar makes the medicine go down, try a capful of apple cider vinegar instead. So whether you eat an apple and just sprinkle it with some plain cinnamon after your workout, or maybe put some sliced pears on that buckwheat farinata waffles, please remember that food can be healthy medicines, and you'll need less medicines if you eat right and exercise regularly. So thank you so much for joining me in the Sunflower House on Memorial Day 2023. And I hope this has been helpful in terms of understanding that calcium is indeed a patriot, but it needs cofactor K2 for absorption, and that it's best to get it in your diet. And yes, indeed, you can have low-fat cheeses in moderation, and that there's a lot more to the story of cardiovascular disease than just cholesterol, and that being less sweet as an adult is certainly important for reducing your risk of diabetes, which is particularly a bad condition in women. But luckily, our treatment options are expanding, just like our treatment options to combat obesity is expanding. But we really have to make that effort to eat less and exercise more because our body simply doesn't burn the same amount of calories as when we were younger. And the other thing is, with age, our stomach hormones are slower to communicate to our brain. And I know in certain cultures, they teach people to only eat till they're about 80% full, with a caveat that you can still go back and get something to eat in 20 minutes if you're still hungry. And so I think rather than just telling someone, no, you can't have a second serving or helping of that, say, well, sure, we can serve you, another helping, but let's, maybe go and clear off some dishes or go play a fun activity. And then in 20 minutes, if you're still hungry, we can come back and serve that or eat that. One tip that I think sometimes is healthy or helpful and healthy and cost effective is whether or not you have a dog or not, you should always bring a doggy bag, so to speak, home from whenever you go out to eat, because most times portions are a lot. And sometimes I'll spend time like on the weekend doing a lot of cooking, because during the week I'm very busy seeing patients and trying to see my grandchildren in my off time. And so when you make a lot of food that's good and tasty, when you know, okay, I can just eat this tomorrow for my lunch, I think you're a little bit less tempted to want to go back and eat that yummy food. Just like my husband just made a wonderful Memorial Day meal, actually a couple of them, and I was glad to not go back and get extras, because I thought, oh, this is great. I can have this, in the future for lunches and a meal when I'm very busy. And I think freezing food and preparing it, always having snacks on hand, and I think that's fine for growing people, pregnant women, growing toddlers, to have snacks, because it usually does not ruin their appetite because they are growing so quickly. But for us adults, particularly people that need to reduce the risk for diabetes, reducing snacking and reducing the time that you eat to intermittently fast is very important, because that helps drive down insulin levels. Like when you go to a fancy restaurant, they usually always serve you very nice bread to start with, because that drives up your insulin levels, because it's a simple sugar, so you'll be a lot more likely to order dessert. So sometimes eating richer foods, higher fat foods first gives you more satiety, as opposed to the comfort foods of bread. So thank you so much for joining me in the Sunflower House. I am your host, Dr. Holly Thacker, and I hope that you subscribe to our podcast wherever you get podcast, Apple iTunes, Google Podcast, Amazon Music, Stitcher, Pandora's Box, Podbean, any of these places. Just hit the subscribe button and please give us a 5-star rating. And if this information has helped you, or you're able to give us a donation for the nonprofit, you can go on speakingofwomenshealth.com and hit the donate button. Thank you so much.